Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How to treat and heal extensor tendonitis. Extensor tendonitis is an inflammatory condition of the tendons on the back of the hands or the top of the feet. These tendons attach to muscles that straighten your fingers and lift up your toes and the top of your foot. /r/n/r/n treatment includes home remedies/activity modification, medications, and physical therapy. This condition rarely requires surgery. /r/n/r/n extensor tendonitis in the hands typically results from overusing your extensor muscles, causing inflammation in your tendons. However, it can also result from an injury. /r/n/r/n extensor tendonitis can occur with activities such as /r/n/r/n extensor tendonitis in the foot results from overuse as well, in activities such as running, especially uphill. It can also occur from wearing shoes that are too tight, or tightly laced shoes commonly worn for running, dancing, and ice skating. /r/n/r/n less common causes of tendonitis include /r/n/r/n chronic tendon pain can lead to a condition called tendinopathy. Though tendonitis results from inflammation, tendinopathy is the degenerationor micro-tearing of a tendon that occurs with long-term overuse. It's important to know which condition you are dealing with because they require different treatments. /r/n/r/n The primary symptom of extensor tendonitis is pain in the affected tendons. You can feel pain from extensor tendonitis when you use the affected muscles or when you move your hand or foot in the opposite direction and stretch the tendons out. /r/n/r/n You might also experience swelling, and your skin might become red or warm to the touch. /r/n/r/n Typically, pain from tendonitis gets worse if you move or use the affected muscles and improves with rest. /r/n/r/n Diagnosis of tendonitis is often possible with a physical exam and review of symptoms. Additional tests may be needed to rule out more serious injuries, like a stress fracture or torn tendon. These tests can include /r/n/r/n extensor tendonitis usually gets better with conservative treatment, such as medication, home remedies/activity modification, and physical therapy. /r/n/r/n home treatment for tendonitis should follow the RICE protocol. /r/n/r/n Immobilization will typically speed healing. Using splints, braces, and crutches limits movement and use of affected tendons. /r/n/r/n Modifying your activities can also address the underlying cause of your tendonitis. Hand extensor tendonitis can develop from poor positioning. Setting up an ergonomic workstation can help significantly. /r/n/r/n Consult with your coach or a personal trainer if your tendonitis is related to exercise. You might need to adjust your technique or training schedule to decrease pressure on your tendons. /r/n/r/n You can treat inflammation from tendonitis with non-steroidal anti-inflammatory drugs, NSAIDs, such as /r/n/r/n Other medications, such as Tylenol, acetaminophen, can help reduce pain from this condition. /r/n/r/n In some cases, you might need prescription anti-inflammatory medications, such as corticosteroids, or pain relievers in the short term. /r/n/r/n Extensor tendonitisboth in the hand and foot is often treated with physical therapy. A physical therapist can help determine the underlying cause of your condition and provide you with an individualized treatment program. /r/n/r/n Interventions physical therapists practice to treat tendonitis can include /r/n/r/n A certified hand therapist, a healthcare provider who specializes in hand conditions, can also treat extensor tendonitis in the hand. /r/n/r/n Surgery is rarely needed to treat extensor tendonitis unless rest and standard treatments fail to resolve the symptoms. /r/n/r/n recovery after extensor tendon repair requires physical therapy, and treatment follows a specific protocol. /r/n/r/n tendonitis can develop in any tendon of the extensor muscles. These tendons are long, thin bands of tissue you can feel on the top of your hands and feet. These structures attach to muscles in the forearm and lower leg on one end and bones of the fingers and toes on the other. /r/n/r/n The extensor tendons in the hands that attach to these muscles include /r/n/r/n extensor tendons on the top of the foot attached to these muscles. /r/n/r/n extensor tendonitis can take weeks or even months to improve. Early diagnosis and treatment are key for a quicker recovery. It's important to determine the underlying cause of your condition rather than just treating your symptoms. See your healthcare provider if you suspect you might have extensor tendonitis. /r/n/r/n extensor tendonitis is a condition that is characterized by inflammation of tendons on the top of the feet or hands. This condition causes pain and swelling. Tendonitis symptoms worsen with activity and often improve with rest. /r/n/r/n treatment for extensor tendonitis includes medications, home remedies/activity modification, and physical therapy. This condition does not usually require surgery. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.